Greetings and welcome to another edition of Caring for Seniors. I am your host, Adrienne Houghton. Now, each week I sit down with Dave Stieglitz, who is the president of Oasis Senior Advisors Jacksonville, and we discuss all aspects of senior living. Today, we are delighted to welcome into the studio Karen Ansell, who is the president of Secure Choice Insurance Services. Welcome, Karen. Good morning, David.
Good morning, Adrienne.
Hi, David. Thank you for having me. Thank you for having
me.
Now,
before we get to talk about everything that Secure Choice does, let's find out a little bit about Karen and how you got into insurance services.
I was raised on a small farm in northern Kentucky with 4 brothers. And we were raised to work hard and be honest. And I've carried that through my career. I started my career over 30 years ago with a large insurance company. And even though it was a really good company, it was captive, which meant I couldn't offer my clients all the plans I wanted to offer. 21 years ago, I started Secure Choices Insurance Services. And at this time, we represent over 75 different companies.
Wow.
I know. And they have Medicare plans, long-term care insurance, life, and annuities, all geared to the senior citizen. So with Medicare, we can custom design a program to fit the individual's needs, not the insurance company.
Wow.
Yes.
I didn't realize there were so many out there.
I think they all send me flyers every month too.
Oh, yes, yes. Sometimes I want to say to somebody, take me off the list. You're just wasting paper. You really are. So what is the process that you go through to find the best plan?
Adrienne, you're absolutely right. Seniors are bombarded with commercials, mailings, phone calls. It's really difficult for the individual to find the right plan for themselves. They need a professional. So the first thing we do is we sit down and we assist them to sign up with Medicare. And you can do so 3 months before your birth month. We also look to see if there's maybe additional benefits available to them, such as Medicaid or low-income subsidy. After that, we get a list of doctors, medications, hospital of choice, pharmacy of choice, and then we research all the different plans, and there are 44 Medicare Advantage plans available, 22 prescription drug plans available, and 10 different Medicare supplements available with 15 different companies.
Oh my goodness.
Exactly. So they need a professional to help them. Once we meet, I have a couple options for them. And then the first thing we do is we talk about how Medicare works. Because if you can get a basic idea of how Medicare works, then you can choose one of those options that I'm showing you.
Goodness me. I mean, that's a lot.
A lot.
I can see why you would need a professional. I mean, there's so many different aspects to it. Now, Medicare has changed.
Yes.
Since last year.
Yes.
So talk us through Medicare now.
So 2022 Medicare, Medicare is divided into 2 parts. Part A and Part B is the original Medicare, and that started in 1966. The Part D prescription drug plan came about in 2006. So we talk about original Medicare first, and if you go into the hospital with Medicare, you're responsible for the first to the 60th day, $1,556. It's not a one-time calendar year deductible. So for example, if you're in the hospital and you're in there for 4 days, you're responsible for $1,556. If you come out of the hospital, and if you're out for 60 or more days, and you go back in, you owe it again. 60 days between stays, I owe it again. If you're in the hospital for 60 consecutive days, the 61st to the 90th day, you have a per day copay, and that is $389 per day. The 91st, and actually because of COVID, I have seen more clients going past 2 months in a hospital, which is the first time in 30 some odd years of being in the business.
Goodness
so it's incredible. The 91st to the 150th day, if you're still in the hospital, they want $778 per day. And then after 151 days, Medicare stops paying. Then we have skilled nursing care, inpatient rehabilitation. So you must be in a hospital for at least 3 consecutive days in order for skilled nursing care to kick in. And that would be like a broken hip or a slight stroke. The first 20 days with Medicare are free. Medicare pays all costs. The 21st through the 100th day, they want you to pay $194.50 per day. So you have a total of 100 days.
I'm already, I'm thinking this is not good. This is why you have to have good insurance.
Correct. And then we talk about Medicare Part B. Now, Medicare Part A is a zero premium as long as you worked at least 40 quarters into the Social Security system. Or you may be on your spouse's Medicare because we had a lot of stay-at-home moms. Part B Medicare in 2022 is $170.10 per month is the cost of Medicare, unless your income for a single person is above $82,000, or for a couple, $181,000. Then your Part B premium will be higher. And it's a sliding scale. The more you make, the higher it is.
Oh my goodness. So, I mean, I don't really know where to start. How do people find out about you? And I mean, that's one of the main things, because you can help them. You can go through which doctors they want. You can go through their benefits that they have and try and work out the best plans for them to enable all of this to make it easier.
One of the great things, I tell you, and I'm very proud of Secure Choices, our biggest way that we get to see new clients is referrals. And that says a lot, that our clients are referring us to other people. We also network. I network with David, and I network with a lot of the facilities around town, the local doctors, and also the adult living facilities like Pablo Towers or Pablo Hamlet, to shaking hands and putting my face out there and my name out there. And they refer people to me as well. Medicare Part B, which is important to understand, is the second part, again, $170.10. Medicare pays 80% of approved charges, and then you're responsible for 20% of the approved charges. If the doctor does not take assignment, they can also charge 15% above the approved charge. So you would owe 35% out of pocket.
Question, how do you cover yourself for these things that you're exposed to?
There's two ways to do it. Having Medicare as primary, you would look for a Medicare supplement.
Okay.
And Medicare supplements there's 10 different options with many different companies. A lot of that is based on benefits versus premium. So we look at a couple of different options for the client. We break it down, and they can pick up the co-pays and co-insurance that we just discussed. The Plan G is the Cadillac plan today in 2022, and it picks up 100% of everything except for a Part B deductible, which is $233, and then everything else is paid at 100%.
It's just completely mind-blowing.
Yeah, but you do have a premium associated with the plan, the Medicare supplement.
Right.
Then we go into Part D, which is your prescription drug plan.
Wow, it's all so complicated.
It's like, Karen, fix it.
Yes.
Now, tell us about Part D.
Okay.
So full disclosure, she runs my Medicare plan for me.
Okay.
And I get the bill each month, but you got me on this plan, and it's covering all this stuff, and I'm not paying an extra premium.
That's the Medicare Advantage plans, which we'll talk about in just a second. So Part D of Medicare. So when you choose a Medicare supplement, which you pay a monthly premium for, now Medicare you pay a monthly premium for, the supplement you pay a monthly premium for, but you pay very little out of pocket when you need to use it. Then you also need a prescription drug plan. There are 22 different prescription drug plans. How I choose the best plan for my clients is I get a list of your medications, pharmacy of choice, and there's great software available on Medicare.gov. And then we research it and I explain exactly what your copays are going to be. But how the standard plan works, and this could be a standalone prescription drug plan that you purchase in addition to your Medicare supplement, or it could be a Medicare Advantage plan, which I'll talk about in just a second, that the prescription drug plan is built right into the plan and there are zero premiums. So the standard Part D prescription drug plan works like this. You have 4 different categories, 4 different stages. The first is your deductible stage. Now you can have a zero deductible or as high as $480. Then the second stage, once you repay your deductible, you have copays. And your copays are depending on tiers. And there's 5 different tiers. The lower cost tiers are generics.
I'm sorry I'm laughing, but it's supposed to be easier when you get older to understand things because, you know.
It's not.
No.
But now they make it so complicated.
You really need to sit down with someone that can break it down. You wouldn't believe it. When clients walk out of my office, they are just relieved.
Yes.
Because I keep it simple, believe it or not.
I know.
Even though we're taking this short period of time, and I am giving you a lot of information, I can break it down for the client. The main thing why Secure Choices has been so successful is first of all, knowledge, of course. We've been doing this for so long, and then plus we represent every different company. But the main reason is service. Is because if our clients have a problem with a doctor or hospital or medication, they call us, and we take care of it for them.
Oh my
So
goodness.
every year you stay with me, I get another commission. So the key to insurance, being successful in the insurance industry, is the clients and keeping them on the books.
So if they're happy, you're
They're happy.
Right.
Exactly.
Right. And you're going to pay a commission to somebody. I mean,
Right.
your whatever plan
Yes,
you
of
do.
course.
So it doesn't cost you any more to work with Karen, but she's got all the plans.
Okay, so we're going to make sure that we've got all your details up on the screen, how to get hold of you, where we can find you, your website, your telephone number,
Great.
email.
Fantastic.
Because we know that there's people out there going, help, and you can solve their problems.
Yes. Absolutely.
I already know
part-
about
yeah.
4 or 5 people that are going.
The hardest part
"I've got
about
to
dealing
let
with
them
Karen is finding her office.
That's true.
She's
That's
on
what
this
clients
little
say.
side road out at the beach that, wait a minute, how do you...
I know, and I actually tell
GPS can
people.
take you some strange ways.
Yes, I actually tell people when they come to the office, it's a home office, and you have to do a little zig-a-zag and a zig
Yeah.
to get there. It's the hardest part about working with me is finding the office.
Finding her.
But once you
can
find me,
her.
Once
it's
you find
actually
her,
a
you've
home
got to.
office. So I tell my clients, I tell them that if the plan doesn't do what I say they're going to do, you can come get me.
You know where you live.
That's exactly it, isn't it? That's exactly
So
right.
I'm very confident in the
What do you
plans.
think is the most important thing that people need to know about secure choice insurances?
I think that they need to know that we're here for them, that we're not just sign the application and never see you again. And to call us if you need help with a doctor or hospital. It's so much easier for us to get involved in the very beginning than for a client to call and say, I've been working on this for months and I can't get it resolved. Because we have escalation forms that we can send to the company and get things resolved pretty quickly. And then also to make sure that when we do contact you for the annual enrollment period, which is in September, that you respond to the email or letter that you receive, and because everybody's needs change. Your health changes, your medications change. So if you send those back to us in September, we'll rerun them for the upcoming year to make sure you're in the right plan.
Just to double check that everything
Double check.
is okay.
Just respond. If you get anything from Medicare, open it, read it, and respond to it. Okay? It's so important. So many people.
Yeah, I know
if,
that.
If someone's not happy with their plan now, if everybody knows about the advertised open enrollment from, what is it, October to mid-December, but we're actually in another unadvertised open enrollment.
We
if you
are.
got signed up for something you did not like, now all of a sudden you discover, oops, this isn't working for me.
Yes, David, thank you.
Yes.
So right now we're in open enrollment period. It's for those who have a Medicare Advantage plan. So if you did sign up for something you weren't not happy with now, you can give us a call and we can, again, get a list of everything and go shopping, get you the best plan. You have from January 1st to March 31st to make one change, and you can do so.
Karen, thank you for coming in and thank you for explaining all of this. I know there's people out there saying, I think she's an angel. I think she's an angel. So
Thank you.
just let everyone know, how can they get in touch with you?
Okay, the phone number is 904-242-8893. We're at 1624 3rd Avenue North, Jacksonville Beach 32250. My website is securechoicesinsurance.com. And please check us out and give us a call.
Absolutely.
Wonderful. Thank you so much for coming in.
Adrian. Thank you. Thank you, David.
I mean, I think it's most magnificent information that we've had for a long time, and it's certainly helping everybody out there. So if you'd like to know any more information, it's going to be on the screen, but you can also contact iwannabuzz.com.